Hi, I'm Leo Whiteside, and I'd like to show you how to use powdered melatonin and how to use it in higher doses that are generally not available with tablets or capsules. Now, when counseling patients on melatonin, the question of dosage often comes up, and also the route of administration must be addressed. Should it be taken orally and swallowed and allowed to digest in the stomach, or sublingually under the tongue to let it dissolve and absorb in the mouth? Now, with capsules that are swallowed, much of the bioavailability is sacrificed because the melatonin is routed through the liver, where much of the dose is inactivated or removed and excreted. Sublingual administration, that is under the tongue, is generally considered to result in higher blood levels and better bioavailability. There are capsules of up to 60 milligrams available, but that is still a small dose compared to the doses of 5 milligrams per kilogram used in animal studies. And its capsular form is not very amenable to sublingual use. For instance, my body weight is about 80 kilograms. So my dose would be 400 milligrams to achieve 5 milligrams per kilogram. So I would have to take 7 of these 60 milligram capsules, and that would be very difficult to swallow and keep down, and especially hard to administer sublingually under your tongue. But there are products offered now in bulk powder form that make higher dose and sublingual application easy. This does require some equipment. Of course, you need the powder form of melatonin. This is a bulk supplement package for home use. I need to know how much to use, so this will require a scale that measures in milligrams. And this is a Maxus milligram scale. It comes with a cord that uses a USB connector, so you need a USB adapter. Then you can plug it into your computer or other power supply. The on button is pressed to turn the scale on. And there is a weighing dish that is applied to the weighing surface. Then the tare button is pressed to zero out the weight of the dish. Now we are ready to weigh the dose. This is a set of measuring spoons for small volumes. We'll choose the 1/8 teaspoon, and then we'll fill it so it is a slightly heaping spoonful. Then we tap it into the weighing dish. Do not tap the edge of the dish with the spoon, because that will damage the scale. The 1/8 teaspoon of melatonin weighs about 439 milligrams. If we want a smaller dose, we use a smaller spoon. Larger dose, larger spoon. This will be my sublingual melatonin dose. Open the mouth, raise the tongue, and tap the spoon on your teeth to release the powder. Leave the powder under your tongue and let it dissolve slowly. This dose is taken about 1 hour to 30 minutes before bed. That gives it plenty of time to dissolve before you get to bed. If it is irritating and uncomfortable in your mouth, a flavored sublingual B12 tablet can be applied in addition. Try to keep it under the tongue without swallowing for about 15 minutes to allow sublingual membrane absorption. This allows most of the dose to enter your circulation without going through your liver. If you have used any type of lozenge with the melatonin to help it dissolve, be sure to rinse this off your teeth before you go to bed. If you wake up at night and it is more than 2 hours before you plan to get up, the dose can be repeated. This usually results in a good night's sleep. Of course, if you take medications or have a doctor for any reason concerning your general health, then discuss this with your doctor. Now, this is general information about how to give yourself a measured dose of melatonin, and it is not medical advice to take melatonin or to take any other substance. I hope this has been helpful to you to learn how to use powdered melatonin for the larger doses. And if you enjoyed the program, please give me a thumbs up and a comment if you can. Those comments are very helpful to make me a better instructor. I'll be available on YouTube and on Facebook, and we'll do some more on melatonin, so be ready and I'll be there.